Good afternoon, or good morning for those who are joining us on the West Coast. I am delighted to join this well-regarded summit focused on addressing rural child hunger and to moderate a discussion around sowing the seeds for wellness with 3 esteemed panelists. I want to start today with a heartfelt thank you to the Share Our Strength and Save Our Children staff that invited me, along with our other USDA colleagues. First, I'd like to give you a few housekeeping items that are listed here. The session is being recorded, and all recordings will be available after today's event. There will be closed captioning and language translation available, and we will have questions and answers at the end of the session. Please enter all of your questions into the question and answer function on the attendee hub instead of the Zoom chat box so we can easily find your questions. As the Director of Nutrition Security and Health Equity at USDA, we are excited to share with you how our department is taking a whole of department, really a whole of society approach to advance food and nutrition security and leverage the momentum of last fall's historic White House Conference on Hunger, Nutrition, and Health. Just a few weeks ago, we celebrated the first anniversary of the historic conference by highlighting ways we are working to accelerate progress on the conference, which the goals are to end hunger, which are really bold goals, improve nutrition and physical activity, and reduce diet-related diseases and disparities. Later today, you will hear from Administrator Cindy Long about how we are serving up solutions by working with all of you here today to deliver non-congregate summer meals in rural areas. Across our suite of 16 programs, we are taking innovative approaches to better reach our participants, to work more collaboratively with our partners, and to maximize the potential to ensure everyone in our country thrives. On October 25th, the USDA Economic Research Service, or ERS, will be releasing the Household Food Security in the United States in 2022 report. Food security means that access by all people at all times to enough food for an active and healthy lifestyle. ERS plays a leading role in research on food security and food security measurement in the United States among households and communities. They are also in the early stages of developing metrics around the emerging concept of nutrition security. Last year, the USDA Food Security Report found that about 34 million Americans lived in households that struggled against hunger in 2021. This is a sobering number, and each of us here today knows the names of children and families that have struggled against hunger. The USDA Food Security Report showed that the number of Americans experiencing food insecurity actually decreased by 5 million. And food insecurity among households with children was at a 2-decade low. The report suggests that one possible reason for this progress is our federal nutrition assistance programs and the critical additional investments we have been making during the COVID-19 pandemic, which helped to combat hunger. Without question, our ability is integral to our partnership with each of you and the work you play to ensure that everyone in our country can thrive. The USDA Food Security Report also found that Black and Hispanic Latina households were disproportionately impacted by food insecurity in 2021, with rates of about 20% and 16% respectively. These rates were triple and double the rates of other households, which was 7%. This report does not adequately sample historically underserved communities, including Native Americans, where other studies have found high rates of food insecurity. And this report does not dive into the mental, physical, and emotional health tolls that come about when you don't know where your next meal will come from. Our next panelist, Ivy Horton, will illuminate this information. But before I pass it off to Ivy and kick off today's panel presentations and discussions, I want to share how the Biden-Harris administration has pushed all federal agencies to drive transformative change around hunger, nutrition, and health through policies, programs, and practices. At USDA, we have been focusing our efforts on changes that would have the greatest potential for ensuring equitable access to healthy, safe, and affordable foods. We are also working to build awareness among our staff and key partners about the sizable body of research indicating that structural racism harms health in ways that can be described, measured, and most importantly, dismantled. We are also carefully examining our existing and potential policies to identify ways to prioritize equity and address the social determinants of health. This is where nutrition security comes in, and where we at USDA and each of you here today can have influence. Nutrition security means that everyone in our country has consistent and equitable access to healthy, safe, and affordable food that is optimal for their health and well-being. You are trusted messengers that can elevate the power of our 16 nutrition assistance programs. These programs are by far the most powerful tools that we have available in the federal government to ensure that everyone in this country has access to, once again, healthy, safe, and affordable food. Our programs reach 1 in 4 Americans, but we know we can do more to improve the health of our nation, and we need your help. Today, I have the privilege to introduce and moderate a panel presentation and discussion with each of you here today with 4 outstanding panelists. First, as I mentioned earlier, Ivy Horton, a site coordinator at Communities in Schools in Gulf South, will discuss the impacts of food insecurity on children's mental, physical, and emotional health. She will also discuss how food insecurity intersects with other needs like housing. Then Tracy Pohl from SAMHSA will discuss their food and mood work in rural communities and how they are engaging youth and the community voice. And to wrap up today's panel presentations, Tamara Melton of Diversified Dietetics will share how her organization is working to include people at the table from all different levels and from the communities that they serve. These will be 3 informative but brief overviews, and then we'll have a facilitated discussion with our panelists and take your questions. So remember, please use the question and answer functions in the attendee hub instead of the Zoom chat box so we can easily find your questions. Let's get started with Ivy. I'll turn it over to you.
Hi, good morning, everyone. It's such an opportunity, a wonderful opportunity to be here and to talk with you guys a little bit about the work that I do and the impacts that I see food insecurity having on kids in the school system specifically. So as Kari mentioned, I work for an organization called Communities in Schools of the Gulf South. You can go to the next slide. Communities in Schools is a national organization. We're present in 25 different states in the U.S. and you can see over 3,200 different school sites that we participated in working with in the 21-22 academic year. And we reach almost 2 million students. So it's a vast reach of people that we are able to work with, and we're so thankful for that opportunity. CIS works to provide services and resources from the community into the public school, just to make sure that they're accessible, coordinated, and accountable for our students and families in the public school system. Next slide. Some of the services that we provide are mental health services, which I am a clinical mental health counselor, so I provide mental health services, but also work with outside resources and community resources to meet other needs like basic needs such as food, housing, hygiene. We do a lot of family engagement of helping to educate parents and caregivers on different topics. We help with academic assistance, life skills, behavioral interventions for our kiddos who need extra supports in those ways, whether they're supports that we can provide in the school or if we can get community resources to come in and help meet those needs. We work in pre-K through 12th grade schools. So for our older kids, we're helping with college and career prep, helping them learn how to make resumes and things of that nature, just lots of life skills that these students can have so that they can be successful, not just in school, but they can achieve in life as well. We work to build relationships with these students so that they know that we're trusted adults who care about their well-being and who want good for them. So specifically today, obviously talking about food insecurity and the way that that impacts my work, as well as I think I have a unique experience being in the school system and working with kids who are hungry and seeing how that impacts their day-to-day life, their ability to participate in school activities, their ability to focus on academics when their basic needs are not being met. So I think I bring a unique and a different perspective to the table. And as Kari mentioned, if you have any specific questions for me as we go along, please put those in the chat so that we can circle back to those at the end. You can go to the next slide. So as I was preparing for this presentation, I started to think through lots of different things, but specifically, I started to think through, this is not a new idea, this idea of needing to have our most basic needs met. I immediately was thought back to Maslow's hierarchy of needs. Abraham Maslow is a theorist, and he made this hierarchy of needs nearly 100 years ago. So just this idea that, if kids' physiological needs, food, water, shelter, things are not being met, then how can we expect for them to succeed in other ways, to achieve in school specifically as it pertains to me. And I think that it's difficult when we don't have this understanding of food insecurity and the vast impact that it has on kids and their mental, physical, and emotional health, because we set the bar pretty high for them in school, not being understanding or gracious to the fact that, they're not necessarily able to sit in a classroom and take in the information that's being presented to them or focus on their assignments because they are concerned or trying to figure out how they are going to get those basic needs met. And when they don't have those physiological needs met, our kiddos, they learn survival strategies, and they learn that they have to do certain things in order to get those needs met. That's where we get a lot of kids who are feeling like they have to take in order to get their needs met, or they have to be manipulative in order to get their needs met. Just a quick side personal experience is I keep a box of high protein, nutritious foods in my office, in my school, just so that they're accessible. And the kids that I work with know that. So they come to my office. And when I first started working in the school, before I had really built these relationships with these kids, I would have kids who would come in and they would say, "Miss Ivy, can I get a snack?" And the answer is always yes, right? I tell my kids, if you can use good words and you can ask, then you can have. And it's kind of this mentality of like seeing a need, meeting a need. And at first, before I had built this relationship with these kids, I would notice that they would ask for a snack and maybe take a couple and put it in their pocket. And I think that speaks to the need that they had. They were saving them for later or taking them home, or maybe they had siblings that they were also going to take a high protein, nutritious snack for. But because these are skills that these kids had learned that they had to do in order to get their needs met, right? When in reality, not knowing that I was a safe adult, had these kids just asked, "Hey, Miss Ivy, can I have 3 granola bars because I'm not sure that I'm going to be able to have dinner tonight, or, my brother might also want a granola bar," or what have you, then the answer would be yes there too. So I think part of in my work is building those safe relationships, those positive relationships, so that kids know that they can ask to have their needs met as well. It's teaching them that their voice has power again, because they've lost some of that in these needs. In my experience, that's some of the things that we see. So you can go to the next slide. So right here, 2 big things. I'm going to start with the image on the right, the iceberg. What we know about an iceberg is that at the top of it, you only see about 10% of what the actual size of the iceberg is. And in this case, we're thinking about the 10% that we see in kids, or just in individuals, but specifically kids for this platform, and the impact that it has, food insecurity has on their well-being is we see their behavior. We see that these kids are maybe irritable, maybe they're acting out in school, maybe they have a short attention span, or they have some like behavioral outbursts throughout the school day. And that is a lot of times what we can get fixed on and have a focus on. But I think what's really important to educate ourselves on, and also to educate those that we're working with in this fight for food security, is that, it's not just their behavior. There's lots of other things that are being affected in this process, starting with, I call these the 5 Bs. This is actually some information that is and some research that was done by Dr. Karen Purvis and Dr. David Cross at Texas Christian University and the Karen Purvis Institute for Childhood Development. So just wanted to give them credit for that. The 5 Bs: behavior, brain, biology, body, and belief system. So all of these things are impacted through their the lack of food insecurity or trauma as a whole, which food insecurity would be considered a trauma. So I think it's important to make note of that as well. But first, we'll start with brain. And as you can see on the left, these are a PET scan of a brain. The one on the far left, where you can see that has the circles that have things inside of them, the red, the green, the yellow inside, that is of a PET scan of a child's brain who had their needs met, who had a safe environment, who had, didn't have any significant traumas in their developmental years. So as kids, and the brain on the right, where you see kind of that empty black space, is a PET scan of a child's brain who had experienced trauma as a child, who had experienced different needs not being met, safety issues, things of that nature. And what we see here is a little science for us. Is you'll see where it says the front of the brain, there's a lot more activity happening there. And then on the right side, there's obviously a lack of activity. Well, the front of the brain, what we're talking about there, where there's a lack of activity, is called your prefrontal cortex. And that is the part of the brain that handles language, understanding of cause and effect, things of that nature, different things. Language, understanding of cause and effect. I'm blanking on all the things that I had listed. But it handles all of our higher functioning, our reasoning, things of that nature. So how, it's one of those things, regulation strategies, that if our kiddos who have experienced trauma and are lacking, their prefrontal cortex is not formed in the same way, then that's obviously impacting their abilities to be present in school, to achieve and be successful in different ways. I think the really encouraging thing that is encouraging to me, and I hope is encouraging to you all as well, is that our brains are plastic and they can be changed. So just because this brain on the right that we see that has the black spaces, is that of a child who didn't have or who had experienced trauma in various forms, doesn't mean that is how their brain will stay for forever. If there are people and there are relationships built to create that sense of safety and to empower this child to believe that they have voice and that they have the ability to just have to have things like to make changes in their life and to have the things that they need, their needs met, then their brain starts to look more and more like that brain on the left-hand side with all the connectivity. So the other things that it impacts, the other Bs, are your biology. Again, this kind of goes along with their brain, but we also know kids who have experienced trauma, so who experience food insecurity as well, their biology, their blood glucose drops much quicker. So it's so interesting. It's kind of a catch-22. Not only do they have a food insecurity, but actually their bodies need more food because their blood glucose levels drop so much quicker. So really, these kiddos need a high protein snack every 2 hours. And it's just hard because, they're not receiving that care, or they don't have that security in their home. And then that obviously impacts their school and their ability to focus and be engaged, but also their body even more so needs that nutrition. And then their belief system, I touched on this a little bit before, but it teaches kids that in order to have their needs met, that they have to be the ones to make that happen, that maybe they're on their own, or that they don't have people who are supporting them. And while that's not always the case, and there are people like you all who are working to help solve this problem and to help make sure that all people in our nation have the things that they need as far as nutrition goes to be successful and whole. There's a belief system along with that if they experience food insecurity for a while. As mentioned previously, oftentimes food insecurity is not mutually exclusive. In the work that I do with kids, the school that I work in is about 800 students. And a lot of the kids that we have who experience food insecurity also experience other traumas in various forms, whether that be homelessness, or their parents experience mental illness of some form, or drug abuse or substance abuse of some form, or also unemployment. So those are all different that kind of go along with food insecurity and the work that I do that just create this even a bigger issue and are definitely impacting our kids in the school system. So those are just a brief overview of the work that I do, as well as how food insecurity impacts specifically the mental health of kids and the emotional health of kids. So thanks so much for letting me speak.
Wow, thank you so much, Ivy, for that informative overview. We appreciate everything that you said. And so now we will transition to Tracy from SAMHSA. Thank you, Tracy.
Hi, thank you so much. Good morning, good afternoon, depending on where you're calling in from. I'm Tracy Pohl. I use she, her pronouns. I want to start today by letting folks know I'm calling in from the state of Colorado, and I want to acknowledge that the work that I'm doing takes place on traditional lands and unceded territories of the Ute, the Cheyenne, and the Arapaho peoples. I also want to recognize the 48 contemporary Indigenous tribes and nations who have historically called the state of Colorado their home. I want to acknowledge and recognize the painful history of genocide and forced removal from their lands and the role that the United States public policy played in this space. I recognize the many diverse Indigenous people still connected to our land, and give thanks to all the tribal ancestors and nations of this place. And we're going to highlight some of the work that some of these incredible tribal nations have contributed to over the next few minutes here on my slide. So with that, let's hop to the next slide. So super thrilled to be invited to the conversation. There are probably people on the line saying, who is SAMHSA and how does this integrate into hunger and work with childhood nutrition, food and nutrition related security? And I want to level set right out of the gate and tell you who we are before I tell you about the Food and Mood Project, the collaborative that we've been so fortunate to be developing over the last several years. As I said, I'm Tracy. I serve as the Assistant Regional Director for SAMHSA. SAMHSA is the Substance Abuse and Mental Health Services Administration. We are an agency within the Federal Department of Health and Human Services. So for folks wanting a little government 101, CDC, NIH, FDA, SAMHSA is one of those sister agencies that falls in that big bucket under the department. I'm specifically located, as I indicated, in Colorado, specifically in our Denver Region 8 office. And I'll talk a little bit about our regions coming up in a second. Depicted here, you'll see our Assistant Secretary for Mental Health and Substance Use, Dr. Miriam Delphin-Rittman. And on the left of the slide, you'll see the 5 priorities that SAMHSA is aiming to achieve, and we're really focused on. And then in the red here, you'll see the guiding principles. The agency's primary priorities are focusing on preventing overdose, enhancing access to suicide prevention and crisis care, strengthening the behavioral health workforce, this conversation about the integration between behavioral health care, which is mental health and substance use disorders in our language, and its role in physical health care. And then lastly, but certainly the most vital in the work that we're doing in the food and mood related space is this idea of resilience and emotional health for children, youth, and their families. I think one thing to really know about the importance for us is this is the first time in SAMHSA's history where children and youth have earned and kind of risen to the their own individual priority at that national level, really showing the commitment all the way up from the White House to the Office of the Surgeon General and at SAMHSA, the fact that this priority, children, young people, and their families are definitely, we're seeing significant health disparities regarding substance use and mental health. And so the fact that it's front and center is to be commended, and we certainly have quite a bit of work to do. We're proud to support this work. And if you take anything away from me today, besides food and mood and how to find our website, my tagline that we talk about at SAMHSA is behavioral health is health, right? So anytime you talk about health, don't forget there's mental health and there's substance use that gets integrated into that conversation. Prevention, just like public health prevention works. Treatment is effective. People actually get better and people recover. So we can go to the next slide. As I indicated, I'm in our Denver region office. There are 10 Health and Human Services regional offices. There won't be a quiz on this, but it's important to know if you're interested in knowing who your Tracies are in the other regions, depending on where you reside and where you work and the communities you're connected to. Shoot me an email afterwards. I can get you connected to these folks. There are a significant amount of resources that warrants an entire presentation on what we can offer in schools, in community-based organizations, working with healthcare providers, you name it. These are your folks that can get you connected to those programs. Let's hop to the next slide. Thanks to Ivy, we talked a little bit about this idea of the iceberg, and I frame this as we're super complex, right? People have a lot of stuff going on that you can see on the surface and that you certainly can't see. So when we're thinking about our approach, so when we think about our approach to mental illness and addiction, we're thinking about how can we be flexible? How is it equitable? How can we be comprehensive? How do we center the people who are living with mental illness or addiction-related healthcare conditions? How are we centering them and having them at the table and helping us design and ensure that our strategy and our approach is right for them at the moment that they need it to be? We certainly know, I grew up in a very small rural community in central New York, and we certainly know living in rural communities has an additional layer of complexities to what you're seeing here on this slide. It's not just healthcare access, but it's transportation, it's discrimination due to the smaller sizes of our communities. We know people are less likely to seek out behavioral health related services, again, because of the bias and the discrimination associated with that, and that your neighbor is going to see you going into the blue house on the corner and understand what the blue house in the corner depicts, right? So we also know, and we'll hear throughout the next day and a half, that rural communities face hunger at significantly higher rates, in parts because of the unique challenges that living remotely has. So let's hop to the next slide. So the more time I have the privilege of spending with our communities in the food and mood space, the more I hear this: how we speak matters, how the importance of language and literacy and presenting a message that's relatable and honors the communities that we're working with, right? So I want this slide to kind of serve as a reminder. Maybe it's a reminder, maybe it's a beginner, wherever it is, that how we talk about mental illness and substance use really can support a pathway for people to get the supports that they need, or it can prohibit that, right? And I think the same goes for how we talk about food and nutrition and security. So let me give you a few examples. So instead of stigma, maybe we try this: bias, prejudice, discrimination, right? So prejudice refers to this idea of thinking, and discrimination refers to as an action. Both of those things can be changed, right? So I find myself saying stigma too, and I have to constantly remind myself and correct myself that this is more than that, right? Like this is a discriminatory act. Next, instead of a mentally ill person, I had this conversation with my young person at breakfast this morning, and he said, "Mom, these are the same." No, they really aren't. And I had a very quick 101 with him in preparation for the discussion today, that people who experience mental illness and mental health conditions, they can and they do go on to lead fulfilling lives, right? They recover, and we're not defined by our healthcare condition, right? Like the one on the left highlights the illness, the one on the right highlights the person. Next, committed suicide, right? How about try this one on instead? Died by suicide. The term committed is oftentimes in our minds, it's associated with a crime, right? When you think about a medical examiner or, someone, outlining how somebody dies, they died, from a long-standing illness. They died from, battle of cancer. Suicide is a healthcare condition, right? Like, so this is part of the discussion. So I encourage you kind of as you go forward and as you think about the communities that you're working with, to really kind of reflect on what some of the language here. We have a lot more resources in this space. So again, if this is an area you want to dive into, certainly find me. Let's hop to the next slide. So you know a little bit about SAMHSA and where we are and how we approach kind of mental health and substance use. But I want to shift gears because you invited me to talk about Food and Mood. And Food and Mood is a collaborative that started in 2019, just before the pandemic. And thanks to our friends at Park County, this is how we got our name, Food and Mood. And what we call ourselves is the Coalition of the Willing. So we're a group of like-minded, committed people that are super interested in the connection between food and emotional health and well-being, behavioral health, mental health, kind of this larger frame beyond what we know about the connection of nutrition and physical health, right? So like that's the unique piece to it. We're super, super fortunate that we've been partnering collaboratively with our friends at USDA, specifically in our Mountain Plains region that you'll see outlined here in red. Our region, Health and Human Service Region 8, where I am, is green, and where, you need me to slow down. Okay. And the region 7 is the Kansas City office. This kind of large region that you'll see depicted here is where the Food and Mood Collaborative is currently taking place. I think the things that are pretty significant, if you want to learn more about the work, we've got the QR code up here that you can scan and it'll bring you to our website. But as I indicated, we're working specifically in this space with federal, state, tribal, and community-based organizations that are really interested in this very unique intersection. And specifically, we're framing it around the K-12 audience. Most of us in our day-to-day jobs and activities work within this K-12 space. It's not to say we don't understand and know that there's a role for that 0 to 5 early intervention space, and that there are not incredible opportunities and work happening in that senior, older adult related space as well. It's simply what we as a team have the capacity to do. So here's our region. Here's kind of the overall goals and vision for where we're going. We can hop to the next slide. So I want to highlight a couple of accomplishments that we've had to date over the last couple of years. We started this conversation by going out and engaging with those state, tribal, community-based organizations, because we know at the federal level, chances are this was already happening and we needed to know who was leading kind of the work already. We spent quite a bit of time, engaging with these stakeholders. I'll highlight a couple of them on my last couple slides, who really went front and center, told us how they were doing the work, and they highlighted what they needed. So we heard that, and we established this coalition where we kicked off with a series of town halls. We developed a website. We, over the course of a couple of years, pulled together 3 individual subcommittees. And it's important to know these 3 subcommittees are still co-led by a food expert and a mood expert. And it's equally important to know they're not federal employees. They are state, community, tribal organizations that are doing the work and operationalizing Food and Mood to ensure both the food and the mood hat were integrated in all of our conversations and all of our activities moving forward. We host a SharePoint site. We learned very early on that you can't send a 42 gigabyte file to share with one another. And so we needed a collective gathering place to be able to drop documents, to be able to put research articles that really kind of built the business case for this connection between nutrition and emotional health and well-being. And then most recently in August, we hosted a regional meeting where we had over 100 participants from across the region come together and join us in Denver for a deeper discussion on how to move the needle in this conversation. And depicted here, you'll see a couple highlights from the day. We had a colleague from USDA kind of discussing the National White House Conference on Hunger and Health. And then on the upper picture, you'll see some good friends of ours doing a food demonstration from our Green Thumb initiative. Happy to, again, give more details on this if folks are interested offline. So the next slide. As I was developing the slides, it made good sense for me to give you 4 community-led examples of food and mood, right? No one wants to hear, the federal government talk about what this looks like. We want to see, how it's being done. So our 4 pillars that you see depicted here, I'm going to get into those examples. And this is kind of this is the language that was continuously coming up in terms of what mattered and what was important to the food and mood partners up to date. So this idea of programming, a dialogue, equitable access, and engagement. So let's hop to the next slide. Number 1, programming. So the idea of effective programming. So meaningful, holistic, and culturally informed programs. So depicted here, you'll see a newer partner to us in the food and mood space, the Zuni Youth Enrichment Project. They're actually a SAMHSA grantee. They receive a grant out of SAMHSA that's called Native Connections that really is focused on emotional well-being, and it actually has a suicide prevention lens to it as well. These folks offer direct programming to to families, and they offer this meaningful, holistic, and centered on culture. And they describe their work as rich in culture, traditions, and art. And you'll see their individual programming activities that they offer to young people with young people. And as part of their programming, they shared with us, we grow, we share, we eat, and we save. Super simple, super powerful. We grow, we share, we eat, we save. There's a very strong sense of community connection, and the youth are partners. They're driving this conversation. They're deeply invested, and they are regularly asking for this curriculum. Pillar number 2, next slide. These are our friends, Park County, Farm to School, Park County, who were some of our initial presenters, our initial folks that were on board with us. They highlight the importance of having young people build that dialogue, right? Have them help be inclusive, have them create this normal public dialogue that is regarding their health, their nutrition, their overall well-being through a gardening lens, through a food lens. Farm to School Park County uses the AmeriCorps program, especially the food core part of the program that's positioned to support this work and build capacity. I would also add there's 4-H, there's HOSA, there's a CDC, Public Health Associates program. All of these are incredible opportunities. So kind of more on that as we go. Next slide, please. The pillar 3 is our Healthy Roots Garden and Food Clinic. This is based in Children's Hospital, Colorado. They take the approach of no wrong door. So they're speaking this kind of common language, whether you go into the hospital for services, they also have this food clinic, this Healthy Roots Garden, and they're really operating under this food as medicine approach. They like to highlight the fact that it's the first pediatric food pharmacy in the Rocky Mountain West. And they also offer a variety of different dietary advice and cooking lessons to their patients and their families as they transition home. So a really innovative, integrated model. And then lastly, pillar 4 is this idea of a multidisciplinary community engagement. And All Nations Health is a mental health center in Montana. And this project called Soup and Stories was really focused on restoring relationships during the pandemic and connecting people to their traditional foods with a conversation and a connection, all through a Zoom platform. So again, finding creative ways to get conversations and resources to communities. I think the thing that really strikes me the most about working in a rural community is these authentic partnerships, right? So you might be funded to work on diabetes, but because of this multidisciplinary engagement, like Soup and Stories, you expand the work to talk about things like family connectedness, mindfulness, suicide prevention, healthy eating, and then incorporate this beautiful conversation with multi-generational pieces of the family. I'll close with my last slide is just to highlight a quote from Michael Pollan highlighting that food, it's not just fuel, it's about family, It's about community. It's about identity. And we nourish all of those things when we eat well. So I'll invite you, include the voice of the living experience to your table, right? Especially young people and their families. It adds value to the work and engage with them meaningfully. And of course, I'll put a plug in to pay them for their expertise, whether it be in your garden, your school, your community, or even your office setting. They'll be super thankful you did. Thank you.
Thank you so much, Tracy. I really do like that quote. And it's exciting to hear about all of these innovative approaches at SAMHSA around food security and mental health, even within our federal family. So thank you so much for that. And I hope everyone has taken down your information on the slide here. Now we will transition to Tamara.
Thank you so much, Kari. We can go to the next slide. My name is Tamara Melton. I am the co-founder, one of the co-founders and the executive director of Diversified Dietetics. My co-founder and I started our organization in 2018 after we had gone to too many conferences and gone to too many networking events and been in too many rooms where we did not see a representation of racial and ethnic diversity amongst registered dietitians and nutrition professionals. I had come from a background in academia and been teaching at the higher ed level for over 10 years by that point, and knew that there were many people who were from these underrepresented groups who were really interested in taking care of their communities and improving their health through nutrition, and that there was definitely a disconnect that was there. And so an organization was needed to be able to support these folks who were looking to get into the field of nutrition and dietetics. We don't have the most linear pathway to become a registered dietitian. And so our organization focuses on what are the barriers that are hindering people of color who are interested in going into the field of nutrition and dietetics. And then we look to create programming and resources that can help to overcome all of those barriers. If you're not familiar with the statistics, there's about 113,000 registered dietitian nutritionists in the United States. About 3% or less than 2,700 of those are Black, African-American. About 6% are Hispanic, Latino. So we're sitting right around 7,000 people. And about 5% are Asian, and even less than that are Native or Indigenous. And so, as you can see, the numbers there are quite low, especially when you think back to what Tracy just said. And that quote from Michael Pollan is that food is so closely connected to people's culture. And so, as I always like to tell people and the students that I work with, is that food is connected to people's culture. And it's often the one thing that they can take from their homeland, from their country, from their communities, from the areas that they know. And so when we don't have colleagues who are trained in what we know to be the science of food and nutrition that we can even reach out to, then we have a blind spot. And so that's what our organization looks to overcome. We are the largest community of nutrition and dietetics students, interns, and professionals of color. And so as we go through the next slides, I'll go into a little bit more of the why and some of the work that we're doing at Diversified Dietetics. So the next slide looks at this question of what is food security. So Dr. Cutright mentioned about nutrition security. And so this is a definition of food security that comes from the Food and Agriculture Organization. And the reason why I wanted to put this up here was tying to food and culture and looking at diversity. One thing that's in here in their definition says that food security is a situation that exists for all people and at all times, and they have the physical, the social, the economic access to sufficient, safe, and nutrition food that meets their dietary needs and their food preferences for an active and healthy life. There are a billion, at least, different ways to eat healthfully. I'll tell you this as a registered dietitian. The easiest way to get someone to eat healthfully is to provide them access to the food that they know how to access, the food that they want to eat, that connects them to their communities and their home, et cetera, et cetera. And so that's why food security is so closely linked to someone's culture and to their diversity. And we talked a little bit about Tracy's part too, about looking into what is it that people have in their communities that they can access, and how it's really important that they have those connections. And also they both touched on, both Ivy and Tracy talked about the mental health. I talked to a lot of friends. As soon as people hear I'm a dietitian, I think they see a food police badge which we are not. We're the best people to eat with. I think Dr. Cartwright will attest to that as well. But one of the things that we really understand is that people choose food for so many more reasons than just the fact that it's nutritious. That's why I always tell my students, people don't eat nutrition, they eat food. And so that's really important to think about that as we think about, especially children, since that's who we're talking about is children. If you go to the next slide, you'll see some more the 6 dimensions of food security. And we kind of touched on these a bit before as well, but I think one that's really interesting in this definition is looking at sustainability. We hear that term used a lot more, talking about long-term regeneration, as it says in here. But when I'm thinking about sustainability, those last couple of words there of the food needs of future generations, which is what we're here to talk about is children, which they're so important and they are our future generations. And so how can we create food system practices that are sustainable for these future generations is extremely important. And so if you go to the next slide, we looked at this stat as well. We looked at the stats of Hispanic, Latinos, and Black families. But just so that you know what the statistics look like, this is also ERS data that came out in 2021. It looks like the households with children and how they have higher rates of food insecurity, households of children under the age of 6. And then the rural communities, though I am excited to hear, as Dr. Cartwright mentioned, that number has come down. So we're seeing less insecurity in rural communities, no doubt because of all the hard work with a lot of the agencies that we have talked about and so many of you who are in this Zoom room today. If you go to the next slide, you'll see that food is not just about food, which we touched on here. And it's so important to look at how household food insecurity or security can affect so many other things. I love that Ivy don't love that there's a slide out there showing the PET scans, but we're seeing the images of how the security in small children, how it can affect so many other parts of their life and their development outcomes. And so as we're looking at food and nutrition with children, we're not just looking at their nutrition status, but we're also looking at how it can affect their development outcomes, their emotional problems. How are caregivers handling this mentally? What's the stress, livelihood, and management strategies? And how does this tie back to culture? Many people have many beliefs around their health, and health beliefs are not, they're not static across cultures. So we don't all have the same health beliefs. There's an iceberg I wish I'd put in this presentation now that everybody had an iceberg that looks at the iceberg of culture. So if you've never seen that before, Google it. It's a really interesting one that shows you the culture that we see above the iceberg and below. People have what's below the water surface. They have cultures of their belief around how much space they want from each other. What do they believe of health? What is their belief around death and life? Obviously, religious beliefs and things like that. And all of those are tightly tied to culture. When we bring a child into a situation and we tell them the food that you're eating at home is not the best, because our dominant culture says it's not the best, and that's what they know. We have to think about the levels that does for the development of the child and the people that they trust the most. Their family members and their loved ones are telling them that, yes, their food is the best for them, or by giving it to them, they're understanding for it to be the best, and how that can actually affect their development as well. That's why it's so important for us to have diversity in our professions and in our teams. And we're going to talk about in a second the way that we develop programs, because that can actually trickle down and actually affect how we're affecting the outcomes for children that we are working with. If you go to the next slide, this was a slide that was shown before by Dr. Cartwright. When you look at food insecurity rates for Black non-Hispanic children and Hispanic households as well. And so we see that there's higher incidences of food insecurity by these children. I do want to tell a quick story though. At Diversified Dietetics, I'll also slow down, sorry. At Diversified Dietetics, we have just started our own accredited dietetic internship program. So we have interns from all across the country, 9 of them. And one of our interns, I'm based in Atlanta. She's here in Georgia. Atlanta obviously is not rural, but she's north of me. She's in Hall County, which is in a very rural area. She is Hispanic. She's bilingual. And she was telling me about a clinic that she's doing a rotation at, and how she's working with children and families. And I was just asking her, how is it going? And she said she was so excited because on her second day of her rotation, her preceptor's already having her lead the conversations with the families there. Why? Because she's in a community that's over 20%, almost 30% Hispanic. She's Hispanic, she's bilingual, she's from the community. So even though she is just starting out her dietetic internship, she's in a community where she can actually help to support people because of the diversity she's bringing into that community. And so that just shows how important it is that people see people who look like them and the difference that our diverse colleagues have and that they bring in. If you go to the next slide, this best practices for community engagement, I have the reference here. I would encourage you to pull this up if you haven't seen this. This is developed by the CDC, but this was already, Tracy, you really touched on this a lot with the programming that you're doing in your work, but I did want to touch on some of the best practices for community engagement. Looking at the historical context before developing our engagement strategy, there might be some things that we need to understand or issues that need to be worked through before we engage with a community in order for us to have successful programming. One of the things that was mentioned in these strategies that might slow us down is time. Even here, we're running out of time to talk about it. And sometimes bringing in the engagement of the community takes more time. But if you want to see a successful program, and if you can go to the next slide, that's really important that we take the time to be able to bring in the community. We understand and we address the barriers that may prevent community participation, and that we support and we build the community's capacity. And all of us are very smart people in this room. We have lots of letters after our names, et cetera, et cetera. The one thing I want to point out down here at this very last bullet point is to value not only our technical expertise, but the community's expertise as well, because they're the ones who know their community best. They're the ones who have the connections, and they can help to give us the resources to be able to provide what we're talking about here at this summit, but other work that we're doing for children that we're working with in rural communities. So with that, I will turn it back over to Dr. Cartwright.
Thank you so much, Tamara. That was just wonderful. We don't have any audience questions thus far, but so many of the things you said resonated with me. And I just have to continue to give, I always give Diversified Dietetics a shout out because I remember when it was an idea and it is making such a difference. So just congratulations to you for the foresight and the courage and the bravery. And it just makes my soul leap every time I hear about the wonderful things you're doing, including the new dietetic internship, which is so important, especially for our future leaders of color and serving communities of color. So thank you again. So remember, everyone, you can put your questions in the question and answer functions in our attendee hub. We don't see any right now. So I am going to just take a point of privilege. We don't have a ton of time, but let's think about community voices. And so as a community-based researcher that works with young children, I really enjoyed hearing about many of the ways that you are engaging youth and incorporating all community voices. Can each of you give us some more information and elaborate on some of the innovative ways that you are integrating lived experience into all the stages of your work? Because I think that's something that we are all working to do. And Tracy, you mentioned a lot of that in terms of language. So just one by one, let's just do that. And Tamara, you had the last word, so we'll go backwards. We'll start with you and then go the other way. How about that?
I'll say one thing that we do at Diversified Dietetics as a value of our organization is going to our community first. If you go to our website, the first thing you see is community. And so we, whenever we develop a new program or update a program, we spend the time to go out and survey folks. We pilot and receive feedback from our communities to tell us if our programming was effective, it was culturally sensitive, et cetera, et cetera. And so that's one thing that we really try to do is to get a lot of input from the community, not only in the development, but also the execution and the evaluation of our programming.
Thank you. Tracy, we'll go to you.
So as I indicated, we call ourselves the Coalition of the Willing. And so anyone that wants to play a role and has something to give, we operate under the mindset of stealing is encouraged. So we host a variety of different resources and materials on that SharePoint site. And we've had an incredible amount of young people, whether it's through a school of public health, whether it's through a school of nutrition, in terms of higher ed that want to do individual projects that look at this intersection. And so they've come and used kind of the suite of resources and wealth of information that's been shared from that community perspective on the SharePoint site to develop projects, to do kind of high level programmatic related work that they then put back into that SharePoint site for people to be able to kind of steal from and use to build their own case. And so I think a great example or great strength of Food and Mood has just been the young people that are in the pipeline to do mental health, substance use, and or nutrition related work that have a safe space in our community to kind of explore and ask questions and in an authentic, meaningful way where the adults in the conversation see them as equal partners.
Thank you. I was just at a summit for America's Healthiest Schools, and the school leaders were even saying we have to listen to the voice of the youth because they're our future leaders, and it's so important. So thank you, Tracy. Ivy, we'll go to you.
Yeah, just kind of piggybacking off of both of these wonderful ladies. At the beginning of every year, we do something, a community needs assessment. So we're really getting the input of all stakeholders. We are specifically in schools, so that looks like talking with students, talking with parents and caregivers, having conversations with school leaders, teachers, all of these people who are stakeholders in the work that we do to really hear, hey, what are the needs that you're seeing? How can we best support you in the classroom? How can we best support you on the weekends when you don't have the meals provided by the school? What are the needs that your family has over holiday breaks and things of that nature? And then being able to take those needs in the surveys that we've administered to partner with community resources and bring them to the table and say, okay, here are the things that our people are saying that they have a need in, and here are the places where we need support, and then inviting those people in on the work to just have the best outcome as far as like the outreach and really meeting the needs of the kids that we're serving.
Thank you, Ivan. I loved hearing about how you had a specific experience and lesson learned in terms of getting to know the students and knowing what their needs are and giving them the snacks and saying, it's okay, we'll get more. I had the same experience as a researcher where they would think, can we have this? Can we have some more? And it's like, if you want more and you bring more friends, we'll bring more food. It's okay, And so establishing that. And, I talked about earlier our new provision for non-congregate meals in rural areas, which is going to help our provisions for summer EBT, which starts in 2024, which is going to be wonderful to help bridge the gap, because we know there are so many children that go away from school in the summer and they're not able to bridge that gap. So we'll be rolling that out. That starts in 2024, and just making new provisions for WIC and diversifying the WIC workforce and helping to improve the WIC food package. So all of those things are just so important. I'm so excited. I don't have any other questions from the chat yet, but I can talk to you all day. So let me pose one more question before we wrap up. I'm sorry, there is one. Sorry, I won't I'll go to the floor. Do you have an example of something that we can send home with our kids to find out their family's needs? We have a food and clothes closet at our elementary school, but we are struggling with families to trust us to help and not get them in trouble. That's a great question.
I have maybe something that I think what we've all kind of touched on is just the importance of relationships. You have to know people to know that you have to know people to know that they have a need in their home. And I think a lot of people who work in a school system or who work for organization in some way, parents can feel threatened, like we're going to report them to DCFS if their kid doesn't have X, Y, and Z. But poverty is not neglect, right? And I think it's really just helping parents see and caregivers know that we care about them as individuals as well, and not just their needs, while we want to help with their needs. So what has been helpful in my work is making contact with parents, just to like introduce myself, have a conversation with them about who I am, the work that I do before sending home anything to ask about needs, and also kind of making it like a non-threatening approach of, yeah, hey, you guys need uniforms? We have a uniform closet. Or, yep, our food pantry at our school is open. We have bags in there if students decide that they need extra then, they have access to that. And we've seen a great increase in our families who are willing to open up and say, hey, like, we're really struggling to keep our lights on, let alone like have the ability to, make sure our pantry is stocked, or my kids only have one uniform shirt. We need things there. So I think getting to know your audience, getting to know the people that you're working with in a caring, compassionate, relational way is always a great step in meeting those needs.
Thank you, Ivy. And so I also saw an example of a school who sent home a survey to ask about these things, and the parents were able to submit it to the community liaison so that they didn't feel like the teacher was, a part of it, and it was kind of more personal. And so that's just another suggestion. So in that we don't have a lot of time, I want to just thank you. This was an incredible panel. It is such an important discussion, and I hope all of our attendees have left with some food for thought on how we can do better together on sowing seeds for wellness among our nation's children and helping them to thrive. This is such important work. So I want to thank you for joining us, for listening, for learning, for asking your questions. If you haven't had a chance to ask all your questions, please do reach out. We shared our email addresses. We're so happy to talk to you. I want to give a heartfelt thank you again to Share Our Strength and Save Our Children for convening today's panel, and to today's panelists, Ivy, Tracy, and Tamara, for sharing your time and your thoughts, and for the very important work you are doing for our children in our country. And to each of you, we thank you for your time today and the work ahead, both individually and I hope more collectively, so that we can ensure that everyone in this country can thrive, and especially our most vulnerable children. So we're going to stop here and let the summit continue. Please make today the most of today and tomorrow's sessions, and we were thrilled to be a part of it. So thank you so much and have a wonderful day.